Hey, Dr. Robert Inesta here from Westchester Sports and Wellness. Our approach to treating sciatica or sciatic pain involves multiple systems. The first and most important thing is doing a thorough evaluation and taking a thorough history in order to determine what the causative factor is. What is the pain generator, first of all? Which tissues are involved? Is it a true sciatica where there's damage or irritation to the sciatic nerve, either from a herniated or bulging disc, or a tight muscle or tight connective tissue somewhere along the course of the nerve? Is it a local nerve irritation? So there are different things that can cause true sciatica. And then, is it not true sciatica? Is it something that may appear to be sciatica but truly isn't? Whether a disc that's either deranged or, again, herniated or bulged that can be referring by itself. Is it a muscle trigger point that can be referring, or a fascial tension point that can be referring pain? So there are different things that may cause similar symptoms. So it's important to determine, again, what the pain generator truly is in order to develop an appropriate treatment plan. Once we figure out the pain generator, then we need to determine the causative factor in the patient's daily life, right? What are they doing on a repetitive basis that is causing harm to the tissue that's creating symptoms? Okay, so are they sitting with poor posture? Are they bending and lifting? Are they leaning a certain way? Whatever it is, there's so many different things that can cause these problems. Are they doing inappropriate exercises? So that needs to be determined, and then that needs to be modified and changed. To me, again, this is the most important thing, because this is how we create long-lasting results. We don't want to just put a Band-Aid on it and have some temporary relief and then the pain comes back. We want to correct the problem, right, as much as possible. So determining the causative factor and correcting it. Now, what we do here in the office is a combination of acupuncture in order to normalize the nervous system, regulate the nervous system, release tension in the muscles and connective tissues, and also stimulate circulation and the movement of fluids. Very important for healing. Then we will use soft tissue techniques such as Stecco fascial manipulation or active release techniques to mobilize the soft tissues and release tension in the fascia and the muscles where they can be actually restricting the nerve movement. So that's very important and very helpful. Then also chiropractic joint manipulation, if that's appropriate. Sometimes the joints in the spine are restricted, so we want to normalize that movement as much as possible. We want to balance the mechanics as much as possible to increase and normalize function, really. Right? We want people moving better. That's really the key. Movement is life. So those are the main passive modalities. Then we will get into active care, like correcting movement patterns. Again, the things that they're doing in their daily life, we want to teach to bend correctly, to lift correctly, to sit correctly, walk correctly, stand correctly. All these different things are very important. So we're educating the patients on how to live in the healthiest way, how to move in the healthiest way. And then we'll also incorporate nutritional interventions, encouraging an anti-inflammatory diet, and possibly some supplements that can help to, again, normalize or regulate neurological function, connective tissue function, and resolve inflammation. That's what we do for sciatica. Again, every case is different, every individual is different, so depending on the individual's needs, that's how we'll develop a treatment plan. I hope you found this valuable and informative. If you did, if you know anybody who may benefit from this information, please share this with them. And if you have any questions yourself, or feel you may be suffering from this condition, or feel that we may benefit you in some way, please feel free to contact us. info@westchestersportsandwellness.com. Also check out the website, westchestersportsandwellness.com. It has a lot of great information there on the techniques that we use and some other conditions that we treat as well. Thanks so much for watching.